Hi, I'm Dr. Ian Johnston, continuing our series on playing in the sandbox with Cerner. In our last video we talked about using simple order sets. I thought that I would make a short video highlighting a special kind of order set which come up fairly frequently, especially in the surgical services. These are known as phased order sets. Phased order sets are used to order multi-step procedures. The best example is surgery where the phased order set will give the preoperative orders, the operative orders, as well as the postoperative orders, all in one continuous set. This is advantageous in that it eliminates double ordering of different things as one keeps entering orders at various times, and it also is convenient for the surgeon in that it gets all of the orders over with and things move on autopilot thereafter. The order sets tend to be a bit long, but one has to remember that a phased order set is generally replacing 3 or 4 shorter order sets. So here we are back in the chart. I'm going to go ahead and order a phased order set, so we'll go to new order entry. And I know that appendectomy order sets are phased, so I'll search for appendectomy. And as I said, we always look to the end to find the pizza box order set. So we will choose this one, and as before we get the little number 1 up in our to-do box. We will click on this and we'll wait for a moment, and again we see the order set, and we will want to modify details rather than sign. So modify details, wait for a bit, and what appears is this fairly lengthy order set. Now you can see that there are a number of phases here. At the top we have goals of care, which is essentially what we used to call the resuscitation status. We have orders for the pre-surgical clinic. We have the pre-operative orders that might take place the day of the surgery. Scrolling on through, we have the intraoperative orders, such as antibiotics that might be given in the operating room, as well as anesthetics. Then we have the postoperative orders, such as removing staples and such things. So it is a fairly long order set, but it takes care of all the different phases of the surgery, from the surgeon's office through the pre-anesthetic clinic all the way through to the post-operative phase. So it actually is quite a convenient way to do things. Once one understands how they work, they're exactly the same to fill out. One will make the choices as one goes through. They will click to sign the orders. They will complete any incomplete orders and then activate the order set itself. It's important to note that the phased order sets behave a little bit differently, in that when you sign them, most often you are actually putting them into a planned state. This makes sense when one considers that one is usually doing this ahead of time. The order set can be completed and then sent in to the OR. The OR or floor can activate the orders as the time comes. And if you look carefully at the order set, you'll see that after each phase, the final order is to inactivate remaining orders as the new phase comes into effect. Now, order sets are a great way to enter large numbers of orders. In our next couple of videos, we will talk about how to enter individual orders, such as with quick orders.